Hello, I'm Bob Challoner, the President and CEO of Southampton Hospital, with another edition of Focus on Southampton Hospital, your monthly program about the events and activities at your community hospital. Today I'd like to welcome Dr. Michelle Cartier, who is a new orthodontist in our community. Welcome to the community and welcome to the show, Dr. Cartier. And we're doing this show in honor of Children's Dental Health Month, and I know that lots of children have orthopedic, or not orthopedic, but orthodontic issues. And I know myself when I was a kid I did, and I understand orthodontists changed considerably, so I'm interested. Yeah, fortunately, exactly. My memories are not pleasant. Hopefully it is a little different. But we'd like to talk about that and what's happening in the field of orthodontia. So let's start off with a little bit about yourself. I'm always interested when I talk to doctors and dentists. How did you get interested in this? When is this something you decided as a young child, or what happened there?
Interesting you should ask, because my orthodontic experience was actually positive when I was a kid, unlike yours.
Right.
And my dad's brother was a dentist, so for a short while when I was in college I shadowed him.
Oh, wow.
And then he said to me, why don't you go and shadow a few other people, but I didn't do it immediately.
All right.
Once in college, I thought, well, I think I would like something in the health field.
Right.
And my mom, being a nurse, said, don't be a nurse.
Right, right.
At the time, my brother was in medical school.
Okay.
And I kind of watched him and said, I don't know, that's pretty involved.
Right.
So then I said, well, maybe something in the field of dentistry. So at first I just pursued dentistry.
Okay, okay.
And after I
Where did you go to school for dental school?
I went to dental school at Georgetown University.
Wow.
And while at Georgetown I thought I wanted orthodontics, but at the end of 4 years of college, where I went to Mount Holyoke.
Okay.
And then 4 years of dental school.
Right.
The thought of going on for another 2 to 3 year residency program was daunting.
Yeah, I was just going to ask you what kind of residency is there.
So programs vary throughout the United States, but they're on average 2 to 3 years. I think in the very near future they'll all become 3 years.
Okay.
But at the time, mine was 2 years. But I finished dental school and then proceeded to do general dentistry for 3 years in private practice.
Okay.
And then actually at the encouragement of my dad's brother, the dentist, he said, you should really consider doing specializing.
Right.
And I always loved orthodontics.
Yeah.
Again, I had a positive experience with my orthodontist.
Okay.
And fortunately, I was accepted at Boston University.
Wow.
So I did my orthodontic residency in Boston.
Really excellent training. Very, very, very good training. Many people don't realize that there are so many specialties in dentistry, that we're used to it in medical professions, but in dentistry there's a world of specialties. And the residency works just like a medical residency, where you're training?
Very similar, except no pay.
Okay. Oh, no pay, really? Wow.
No pay.
Wow, so that's quite a commitment.
Yeah, very similar.
And it was 2 to 3 years?
Mine was 2 years.
Okay.
There was a program at BU that was 3 years.
Okay.
That included a year of research, and that was actually a special program.
Okay.
So when you applied to BU, you actually had to apply to the research program.
Right.
I applied to the clinical program.
Right, okay.
And at the time, there was a gentleman there by the name of Anthony Gianelli. He was the chairman of the department.
Okay.
Amazing man. And fortunately, I had the privilege of training under his direction, because he's why I love to do what I do.
Wow, that's spectacular. And how'd you end up here on the East End?
Well, I'm originally from Western Massachusetts, which is quite rural.
You're right.
And when I first moved to New York, I was working in Nassau County, which
it's not
was
rural.
overwhelming.
Right,
the drive to work in the morning was enough
you feel
to
like
give you a heart attack.
you feel like you've been at work all day by the time you get to work, right? Yeah.
Yes. So my husband, who is originally from Long Island, said to me, why don't you look out east?
Wow.
It's beautiful.
Yeah.
So fortunately, at the time, there was a population of people that needed treatment, and I was able to open my door and welcome them.
Well, that's wonderful. And I know it is beautiful, but it's also an area that's still underserved by medical and dental professionals. So we're always thrilled when somebody joins us here in the community. And you've been out here now for?
I've been here since 1998.
98. Okay, I didn't realize it's been that long. Okay,
Yes.
great. Very good. Very good.
But I'm only 29.
Yeah, exactly. It's that good dental care keeps you young, right?
Keeps you going.
Exactly. So I also understand that you're board certified orthodontist, and let's talk a little bit about board certification. What does that entail?
Well, first, thank you for asking me
Right.
about that, because that is very dear to my heart.
Right.
It was difficult to do.
Right.
It's completely voluntary.
Okay.
There's the American Association of Orthodontists, which is in charge of all of the orthodontic programs, et cetera. But then there's the American Board of
Okay.
Orthodontics,
Okay.
which is an entity unto itself. And they promote you taking additional exams, coming to St. Louis where their headquarters are for additional interviews about cases,
Well.
and then returning, and this is over a period of about, well, you can do it in 2 years, you can do it in 10 years,
Right.
but you eventually bring the cases or the patients that you have treated at your office to them in St. Louis with their write-ups, and you present them.
Like a defense for a
Exactly.
dissertation. Sort of.
Very
Wow.
good, and it was
Right.
exactly like that.
Wow.
It was
Wow.
definitely a defense.
Yeah.
And it was very rigorous.
Yeah, I bet.
But I'm thrilled that I did it,
Yeah.
but I'm glad it's over.
Yeah, I bet you are. And do you need to be recertified every
You do,
Yeah.
every 10 years.
Every 10 years, wow.
Every 10 years.
A lot
So
of
you
work.
have to, as you know, take additional continuing education credits every year as an orthodontist, certain number of credits every year. But this is in addition to that. And
Wow.
again, this is voluntary.
Wow.
So if in 10 years you don't necessarily want to do it, you drop your board certified status.
Okay. So, dental school, residency, board certification, it's quite a lot of training you have there. I'm very impressed. So
Thank
we won't
you.
talk about what the administrative training requirements are. So let's talk now specifically about orthodontia. What exactly is orthodontics? I know that a lot of people know about braces and all that, but it's really, what is the sort of formal definition?
Well, fortunately, people think orthodontics and they think braces, thank goodness.
Right.
Because, oh, teeth straightening. Well, orthos, from the Greek word, means straight, proper, perfect.
Okay.
And dontos, meaning teeth.
Okay.
So, orthodontics. But nowadays, you have more than just braces as an option.
Okay.
So, anytime there's malalignment or malocclusion, meaning your bite is off, when you actually close down and you put your teeth together, if your teeth don't align, it's malocclusion. It can be addressed, but not always with braces.
Okay.
A lot of adults in recent years are pursuing orthodontics, but with different options, such as retainers, aligners.
Yeah, and I'd like to talk about
Etc.
that a little bit. But the first question I want to ask is it painful? Right.
Well, you said
My
earlier
memory
that
of
you
childhood,
said it
I
was
remember
painful.
tightening up the wire, and it was for days. It was ouch. So yeah.
See, I remember tightening
Yeah.
the wire and going home and eating dinner.
Wow.
I guess
Oh,
I was
boy.
hungry.
Yeah.
No, fortunately, it's more discomfort.
Okay.
It's more discomfort. Nothing that an over-the-counter,
Aspirin.
Advil,
or
Advil,
Tylenol.
Motrin, Tylenol. It might be a little bit of discomfort for a few days.
Right.
But the materials that they have nowadays are so advanced that it's a continuous, light, gentle force
Okay.
versus one strong force. When you said you remember them
Right.
tightening the wires,
Right.
that was one strong, hard force.
Okay.
These are more continuous, light, and gentle,
Okay.
which is better for your teeth as well.
Yeah, I would think so. I mean,
Yeah.
to suddenly pull them back, it would
Yeah, much
be
better.
very difficult. What about who needs orthodontic treatment? Is this something everyone needs, or let's talk about when, particularly for children, you look at a kid's mouth, and when do you make that recommendation? Yes, we really ought to go ahead.
Well, the American Association of Orthodontists recommends that you bring your child to the orthodontist at 7 years old.
7, okay.
They say 7.
Right.
Now, some children come at 7 and they don't even have yet their 6-year-old molars.
Right.
Molars that usually, first adult molars, they usually come in around 6 years of age. But they say, come look anyways. And then there's some 7-year-olds who come in and you just look and you're amazed that they have the mouth of about a chronological age of 10.
Really?
7 is the age that they say. And again, most 7-year-olds don't need something, but some things are best caught early.
Okay.
So if you catch something early, it's
Tooth
easier.
that's sort of migrating out in the wrong
Right.
direction
Or
something.
say, for example, someone has had trauma, fallen off a bicycle while learning how to ride a bike. The baby teeth might have been in the mouth at the time,
Okay.
but the adult teeth actually get affected by that trauma.
Oh, they do.
They
Okay.
do. So you can address when the adult teeth come in at 7, because they're in around 7, 8 years old, addressing those so you don't have additional trauma to those.
Okay.
Or if, say, a child has a habit, finger biting, thumb sucking, tongue thrust,
Okay.
all of those are best addressed early.
Okay.
And those can also be from medical conditions, such as enlarged tonsils, enlarged adenoids. So you'll have a team approach between the orthodontist and the ear, nose, and throat physicians.
Okay. And is it, parent wants to bring their kid in at 7, should they see a general dentist first, or should they go directly to the orthodontist?
Good question.
Mm-hmm.
Most general dentists will say, you know what, I think maybe it's time that you go see the orthodontist.
Mm-hmm.
But frequently in my office, I'll actually get calls from teachers saying there's this little boy in my classroom, or there's this little girl in my classroom. She's only in 2nd grade. Is it okay if I tell the parents to come see you?
Mm-hmm.
More than fine. So no referral is required, but if the general dentist recommends that you come, of course, come. But you can just come on your own as well.
Wow.
So 7's the magic number.
7 is the magic. And when, because I remember when I was a kid, and I've heard parents talk about, even with my own kids, it was, you know, when's the right time to put braces on a kid? Is it, you know, do you wait for all of the teeth to come in, or is there any magic formula or criterion to do that?
I'm laughing because that's a big controversy
Right.
in the educational field of orthodontics.
Okay.
And depending on what program you're trained at, really probably the philosophy that you take on.
Okay.
However, there's phase 1 orthodontics, which if someone comes in and has teeth all over the place that are susceptible to trauma, and they might only be 7 years old.
Okay.
Or they might have a crossbite where the molars in the back are inside the bottom molars, so the top molars lie inside the bottom molars. That's called a
really?
posterior crossbite.
Okay.
Or an anterior crossbite where a child's top front teeth are behind the lower front teeth.
Okay.
All of those are best addressed early, and that would be phase 1 when there's still primary or baby teeth in the mouth.
Okay.
Phase 2 is when predominantly adult teeth are in the mouth. You could have a few here or there, baby teeth. But that technically could be phase 1 if the child didn't need phase 1 early interception.
Right.
So it can be, it's varied.
It is.
It's
okay.
varied. So most likely if you do bring your child at 7 years old and there's nothing outstanding that needs to be addressed immediately, they'll tell you to come back in a year just to keep a close eye
Okay.
until it's close to the point where there's just minimal number of baby teeth left remaining.
Okay.
And then it would be time to start. Although you can do orthodontics at any age.
Well, that was going to be my next question, exactly. Is there a magic window if you're past puberty and all your teeth are, and do they set at some point where it's impossible to correct them? So
No, fortunately. So oftentimes adults come in and it's something that they may have wanted as a child,
Right.
and their family couldn't necessarily afford it or didn't necessarily have access to it.
Right.
And fortunately for adults, it's never too late.
Okay.
I've had patients as old as 80. And
Really?
I said to the woman, you really want braces?
Right.
And she said, my mother lived till she was 102.
Right.
So I don't want to walk around with these teeth looking like this for any longer than I already have.
Wow. It's nothing like optimism, I guess. Exactly. We want those optimistic patients, right?
Yeah. But adults coming in have
Right.
so many more options nowadays.
Right.
So you're not just going to be thinking, oh, metal mouth.
Right.
4 eyes, metal mouth, all
Right,
these
exactly right, all those
train
nicknames.
tracks, all
That's
these.
right.
Exactly. So there's clear braces for adults. There's clear liners, which can be removed. So if there's, I've had several patients who...
What are those? Clear liners?
Aligners are removable appliances
Okay.
that actually move your teeth, but you as the patient have the control of taking them in and out.
Oh, all right.
So say, for example, you have a job where you are self-conscious about people speaking to you with it in your mouth, you can remove it before you go to work.
Oh, interesting.
And take it with you and put it back in when you're driving home at night.
Interesting. Do you have to sleep with it? Is it something?
That's actually the easiest time to wear the
Okay.
aligners, just because it's happening and no one's looking at you and
Right.
you're not talking.
Right.
Ideally, braces, and there's clear braces, ideally braces have the most control.
Okay.
With braces, whether they're clear, and the clear ones are porcelain, so they don't stain. It's
Oh,
kind of like a
right.
dinner plate.
Right.
Or
And when we say clear, what part is actually clear? The piece that sits on the tooth?
Yes.
Okay.
The
There's
brace
still
part
there's
that's-
still a wire that's
there's
visible?
still a wire,
Okay.
but wires now come, not only are they the silver stainless steel,
Right.
there's all sorts of materials that they're made out of,
Right.
but there's also white wires.
Oh, wow.
And in some instances, there's actually clear wires
Okay.
that are computer generated.
Really?
Yeah, that's something new. Yeah, it's a little bit more involved.
Yeah. What do you mean
But-
computer generated?
What they do is that you work with a specific lab,
Yeah.
and the lab uses a particular material, and they move the teeth into ideal position, but gradually.
Oh,
And
wow.
each step along the way, they fabricate one of these clear wires to move the teeth to that position, and when that wire is maxed out, you can go to the next wire.
Wow.
Yeah,
Fascinating.
so it's come a long way.
Yeah, I'll say it's come a long way.
And with the braces, the advantage of them, unlike the aligners, I mean, the aligners are getting better, but with the braces, you can move a tooth in any direction. You can move a tooth back up into someone's mouth.
Well, that was the question I had, was when are there any hopeless causes? I have a niece whose two front teeth literally came in, rather than flat facing front, came in basically sideways, and she's now has orthodontia.
Yes.
But I remember thinking they're never going to be able to correct this kid's teeth.
No, that's actually an easy one.
Is it really?
That's
Okay.
actually an
Oh,
easy
good.
one.
I'm glad to hear that. I'm glad
Yes,
to hear
no,
that.
there's hope.
Yeah.
Really, no. And when you think, or the patient thinks it's hopeless,
Yeah.
as an orthodontist, you can work with, obviously, a team.
Right.
Work with the ear, nose, and throat people if there's enlarged tonsils or adenoids. You can work with the periodontist,
Okay.
deals with the gums.
Right.
So you get clearance from the periodontist to put braces on the adult patient, and then that periodontist monitors the adult while they're wearing the braces. And then you have either the general dentist or the prosthodontist who can actually eventually do the restorative work.
Okay.
So and if you're missing teeth, it's not impossible. Everything is doable.
Well, that's pretty amazing. Did you still have to remove teeth? I remember that was, I'd always hear about I didn't have that experience, but I remember kids who went to the orthodontist and they said they had to have some teeth removed. Is that actually, I always wondered, does that really happen? Do they actually remove teeth sometimes?
I have teeth removed.
Oh, okay. All right. So.
We try, just like everything evolving in life, whether it be, we used to have those big Walkmans, and now everybody has the tiny iPods, so things evolve. And what we try to do nowadays as orthodontists is to not extract adult teeth.
Okay.
We take a conservative approach, because you can never put them back.
Right, right.
So if we take a conservative approach, and what I like to do in my office is, let's try not to.
Okay.
Let's see if we can not disturb the natural envelope, see if we can eventually fit all of these teeth in. Try for 6 to 9 months.
Right.
If we're really pushing the envelope, in other words, there's only so much bone, and the teeth have to be over the bone.
Right.
Otherwise, you'll take the braces off, and the teeth will go back, not necessarily to their original position, but they will move.
And they will, okay.
So for the most part nowadays, we can do pretty much everything non-extraction, but every once in a while, in severe cases, if there's not enough bone, we do have to take teeth out.
Okay.
Fortunately, the pendulum has swung where when orthodontics started, we never took teeth out.
Okay.
And then there was a period of time where we always took teeth
Right.
out. Fortunately, the pendulum has swung back towards less extractions.
How long? I mean, that's the question that people.
get that
I remember
question every
my
day.
kids when their braces went on. I was thinking to myself, how long is this going to go on? So.
Yeah. On average, it's about 18 months to 2 years.
Okay.
Every once in a while, cooperation
Right.
plays a role.
Yeah.
If you ask a patient to, say, wear elastics or brush better,
Right.
because all of that plays a role.
Does
If you
it?
have healthy gums and bone, the teeth move more efficiently.
Oh, really? Interesting.
So if your children aren't brushing,
Right.
they're not necessarily going to get as rapid movement.
Okay.
But on average, it's about 1.5 to 2 years.
Does it take longer for an adult whose mouth, I mean, my sense is that kids' bones are softer and more pliable. Does it take longer?
It does take a little bit longer.
Okay.
A little, not much, but it does.
Just a little bit more.
And the adults are a little bit more sensitive.
Right.
They feel a little bit more discomfort because their bones are more dense.
A little
where
bit
the kids
harder.
are a little bit more malleable bone,
Right.
as well as kids are very adaptable.
Yeah, they sure are. I
As
watch kids fall, and the adult would stand up,
pop
and
right up.
Exactly, it would
Yeah.
have been a major trauma.
Right,
but
we'd be in therapy, physical therapy for weeks.
Exactly
Weeks.
right.
Yes.
Once braces are on, I mean, it used to be, you know, people would be very cautious about what they could and couldn't do. Can you play sports? And also, what about like a musical instrument? If you know, kid plays a trumpet or, you know, tuba or something like that, are there any limitations once they have orthodontia?
You know, really with the design now of the braces, they're much smaller, they're smoother, less of a profile, they don't stick out as far from the teeth.
Right.
There's really no limitations. For
Okay.
all sports, we recommend and we give them mouth guards.
Okay.
Fortunately, nowadays you see
Well, that's probably a good
professional
idea
players.
in any, right, exactly.
So whether or not you have braces or not,
Right, you should have a mouth
and it's
guard.
cool because the
Right.
professional players have them,
That's
which is
right.
a good role models for all these kids. As for musical instruments, it's just a matter of your lips getting accustomed to them being there.
Okay.
And
Because
again-
they're a little rough on the inside
Right.
of the lip. Yeah.
So the kids come and, you know, they will put the braces on and say, oh, I have Hamia or Scamia, all the different
Yeah.
musical things that New York State fortunately offers our children.
Right.
Fortunately.
Yeah.
Just give it a little time.
Okay.
So if a child was going to have, say, an important performance or some sort of big musical thing going on, I might say, you know what, why don't you just wait until a few days after you have this rendition, audition, whatever the case may be. Because it does take a little bit of getting used to, but it's definitely doable.
But there's no harm in potentially the trumpet against the kid's mouth
No.
or something like that
No.
affecting the way the braces are working.
No,
So,
fortunately, no.
they still use the bands around the teeth braces, or it's
You-
you said it's a different type of brace now. So.
Yeah, you can,
Okay.
and in some instances we do.
Okay.
And then that's for really the back molars.
Okay.
For all the other teeth, the facial aspect or the front of the tooth, unlike your niece who grew in like this, the facial
Right.
aspect of the tooth, the brace just glues on.
Okay.
And it's tiny. And it's glued with a special bonding material or
Right.
glue that has fluoride in it.
Oh.
So the fluoride actually promotes no cavities.
I was going to ask about that. So this thing is on the tooth. One, why doesn't it create a stain or something on the tooth? And then two is any recommendations for a parent who may have a kid with braces? Are they? I had an orthodontist who was very strict about not eating sweets, and is that still the case, or what's the?
Well,
I guess dentists
I
don't like
personally-
sweets anyway. I'm asking the wrong person about sweets. I need to talk to a baker, I think, right? Exactly. Right.
Fortunately, all the glues have fluoride in them.
Okay.
And the fluoride prevents the decay.
Okay.
But there's nothing like the day in and day out taking care of your body.
Yeah, absolutely.
Frequent brushing. It's one thing to have a state-of-the-art toothbrush on your vanity in your bathroom,
Right.
but it needs to be used.
Yeah, absolutely.
And frequency is really what makes the difference, both with respect to brushing your teeth. I mean,
Okay.
if you can do it after every meal, of course I don't expect kids to be brushing their teeth in school,
Right.
but if they come home right after school and they have a snack when they get home, go ahead and brush your teeth because you've
Right.
eaten lunch at school and now you've eaten a snack. Brush again after dinner and always, always before bed.
Okay.
And before bed, in my office, we prescribe a toothpaste that has a little bit of extra fluoride.
Oh, wow.
But you think of it like a medicine.
Right.
You only want to use that once a day.
Okay.
Once a day.
Any
And-
particular techniques for brushing teeth with braces that parents should be concerned
Yeah, we
about
give them a
with their kids?
special toothbrush
Okay.
that can go above the brackets and below the brackets.
Okay.
And it really involves a little bit of extra time.
Okay.
I tell the kids, take your iPod in there.
Right.
Put your earphones in and dance away and brush.
Right.
But look in the mirror and make sure you're getting every tooth.
Make sure you're getting it.
Unfortunately,
Exactly.
most songs are more than 2 minutes, so
Yeah, exactly. That's enough time then for them.
yeah.
Once the braces come out, there's that period then with retainers and headgear. Is that all still? That's still done? And
It's
how
still
long
done,
does
but
that
it's
last?
changing, thank
Okay.
goodness.
Yeah.
This is another area of discussion in the world of orthodontics. Retainers are are given after the braces are removed.
Right.
And it's just to hold the teeth in that stable position that you've achieved after 1.5 years, 2 years worth of treatment.
Okay.
Most of the time we tell them, well, if you tell a child 24/7,
Right.
you'll maybe get 18 hours.
Oh, really? Okay. Yeah.
So if you tell them 12 hours, you're maybe going to get 2.
Okay.
So we kind of over-prescribe them at first,
Okay.
and then gradually cut down to nights only.
To nights only. And
Yes.
for how long, typically?
I do it for a good long while because
Yeah.
then we always have to take into account wisdom teeth.
Oh, right.
And the wisdom teeth usually are not erupted by the time a child finishes with their braces.
Right.
Usually by high school, early college, the wisdom teeth start coming into play. And then
Okay.
also, do the wisdom teeth cause relapse, or is relapse just caused naturally?
Right.
So if you have a retainer, and you don't even have to determine what causes it, prevent it.
Right.
Prevention.
So stick with the retainer.
So you're sleeping.
Right.
Put the retainer in.
Right.
Let the retainer hold your teeth while you're sleeping. Get up in the morning, take it out, brush it. Put it in a case away from the dogs. Dogs love to eat retainers.
Right. Right.
And your teeth will remain straight.
I stopped wearing my retainer too soon. The space opened up, and every kid I see with braces now, it's don't forget that retainer. It's going to be with you the rest of your life, those teeth, hopefully. So it's.
And fortunately you say that
Yeah.
because that is one of life's biggest wives' tales.
Yeah.
You can have your teeth forever
Right.
if you take care of them.
Absolutely right.
Regular visits, and that's the thing, you need to go to your general dentist
Right.
regularly,
Right.
even though you're seeing the orthodontist every 4 to 6 to 8 week intervals.
Right.
You need to go see your general dentist every 6 months. And frequently, if a child is not a good brusher, I'll say, you know what, you need to go every 3 or 4 months.
Interesting.
And with the adults, we have not only their general dentist monitoring them, but also the periodontist.
Okay.
And we do about 3 or 4 month intervals, depending on the adult.
Let's talk a little bit about adults. So an adult's lost a tooth. Can they, and their teeth are misaligned for whatever reason? Is it possible to, I would worry that if you had a cap or something like that, does it make it more difficult? Is it still possible to have orthodontia to straighten your teeth?
Still possible. You can put braces on teeth that have caps. Sometimes the loss of a tooth turns into the ideal time to treat because
Really?
sometimes you need space.
Okay.
Often adults are crowded.
Right.
So if you've lost a tooth, you can use that, whether it be an extraction space or the lost tooth space. You
Okay.
can use that space if you think of it like beads on a string.
Right.
So the teeth are the beads, the string is my wire,
Okay.
and I can just move the teeth like beads on a string subsequently into the available space.
Without having to necessarily have an implant or.
Right.
Right.
Then, when the movement's done, if there's still enough space for an implant and that works well with your bite,
Okay.
that's the time to do the implant.
And what about headgear? Is that something that people still wear?
Not too often.
Yeah, okay.
Not too often. Although I hear in other countries they wear them.
They still do it, okay.
But if you can get a kid to wear a headgear,
Yeah.
let me know your secret.
I remember for a while, briefly, it was kind of cool, and why kids thought it was cool, I have no idea. But
They just flipped it around and now
right,
it became
exactly.
earphones.
Yeah, I'd like to show up at the office with it on. Also, just the last question, but there's lots of advertisements certainly about perfect teeth and go and get 1 or 2 visits. How real is some of that advertising that we see? It sounds like anything in healthcare, it really takes a sustained effort to me. And is that your opinion as well?
Yeah, it takes a sustained effort. What you're seeing in those advertisements are quick fixes,
Right.
whether they're cutting a tooth down and just putting some sort of a porcelain jacket over it.
Okay.
It's not moving the tooth into ideal position in the bone.
Okay.
So yes, be wary.
Okay.
Be wary. It does take a sustained effort on both the patient as well as the orthodontist, as well as the general dentist.
Okay. Yeah, it seems like a commitment you really need to make, which
Yes.
we should do in health anyway. So.
Well, if you think about it, we're very
Right.
facially orientated.
Right. Right.
And you walk into a room and oftentimes that's the
Right.
first thing someone sees.
That's
and
right.
Hopefully your smile is beautiful when
Yeah,
that
exactly
happens.
right. We want people smiling.
Yes.
And actually, one last question before we're done here is an adult maybe who their orthodontia didn't work, can they go back as an adult?
Absolutely.
Right. So it could
Absolutely.
be repeated.
Yes.
Okay, great.
There's things that we make sure are not problems before we begin, but repeats are definitely possible, and then they will wear their retainer.
Yeah, they will. I think adults will probably
Adults
be
are
pretty
super
good.
cooperative.
I'm sure they are. Also, we're the ones paying for our own orthodontia.
Yes.
Well, Dr. Cartier, thank you very much for
Thank you for having me.
your wonderful work and good description. And I'd like to also make sure that you're happy and available in the community. I know that
absolutely.
Know
Thank
how to
you for
get a hold
having
of
me.
you. And for all of you who are watching today, thank you for tuning in. Thank you to our friends at CTV for producing and airing this show in Southampton, our friends at LTV for showing in East Hampton. And I'd like to ask any of you that have any questions, would like to follow up with Dr. Cartier, please give my office a call at 631-726-8555. Good health, everyone. Thank you.